I would definitely recommend looking elsewhere for that experience because this is not going to be clinical experience. Welcome to the OldPreMeds Podcast. My name is Dr. Ryan Gray, and I'm excited to have a chat with you today where I get to answer your questions that you ask at premedforums.com. And today's question is about clinical experience and what specifically counts as clinical experience, because this student is looking at a potential job or volunteering at a location, and they're wondering if it would count as clinical. If you have a question you want answered here on the podcast, again, premedforums.com, go to the non-traditional pre-med discussion where I can answer your question. That's right where we take these questions from. Our student today says, I have an opportunity to volunteer at a local free health clinic working in the lab section. The lab section offers clients basic clinical laboratory tests and delivers results the same night of their appointment. The clinical lab is not a research or academic lab and has limited client interaction, such as receiving samples, explaining the laboratory tests to clients, and answering questions about the laboratory tests being performed. Lab volunteers work closely with the healthcare provider on shift. The clinic's laboratory services include urinalysis, dipstick and sediment, gram stains, KOH, digestions, saline wet mount analysis, rapid strep A testing, rapid pregnancy testing, and rapid HIV testing. I need clinical experience. Should I go for this opportunity? All right, so let's first break down the distinction. What is clinical experience versus volunteering versus shadowing versus, right? A lot of students get confused about this part of the journey. Now, when we talk about clinical experience, one of the biggest questions that comes up is, well, I was doing paid clinical experience. I was a nurse or I was an EMT or whatever I was being paid for. I need clinic or a volunteer clinical experience. And that answer is no. You don't need to have paid and clinical. You don't have to have clinical and no paid. There's no right combination for paid versus clinical or paid versus volunteer. Clinical experience. Clinical is clinical is clinical. So if you're getting paid for that clinical experience, great. It doesn't lessen it. If you aren't getting paid for clinical experience and you need clinical experience, go volunteer. Usually the paid experiences, you need some training, some certificates, something like that to be able to do those experiences. With that said, this specific position, well, let me back up just a minute. Shadowing, on the other hand, is not clinical experience. And I talk about that specifically because when you are entering in your activities in the application, shadowing is a separate entry. It's a separate checkbox or separate drop-down menu item when you are filling in your activities. So you have paid clinical experience, you have non-paid clinical experience, and you have shadowing as a separate activity. So shadowing is different. Shadowing is passive. Clinical experience is typically more active. So with this student, with this question, the student tells us if this is clinical or not. In their question, the student says, the clinical lab is not a research or academic lab. That's not the important part. And has limited client interaction. Limited client interaction. I'm not sure the client part. I'm assuming it's more of a, usually clients in the patient, the medical world, client is more from a psychology standpoint. Usually mental health clinics will call patients clients. So I'm wondering if that's the type of clinic this is, but doesn't matter. So the student says limited, let's use patient interaction. That tells me almost immediately that this is likely not going to be clinical experience. It doesn't matter if it was a free health clinic or not a free health clinic. It doesn't matter that it wasn't research. It doesn't matter that it's not an academic center. What matters is that patient interaction. And so a lot of students will like to ask me, well, what about this position? What about that position? What about this? What about that? And I always go back to, I don't know based on the title. All I know is based on what you did. Now, there are some positions where maybe half of it is non-clinical, but half of it is, and you can count the half that is as clinical. Just don't overinflate your hours to count the non-clinical stuff as well. So be careful with that. So this specific question, this specific student, limited patient interaction, that tells me this is likely not a clinical experience. Will it be good experience overall? Potentially. If this student needs clinical experience, I would definitely recommend looking elsewhere for that experience, because this is not going to be clinical experience. So again, clinical experience is interacting with the patients as much as possible. Now, there are some weird caveats to this, right? Scribing is a clinical experience, but there's usually not a ton of patient interaction, and it depends on the physician that you're scribing for, the location that you're scribing at. It depends on what that specific setup is like in each location to determine if there is any interaction or not. So scribing, we consider clinical experience. It's not a ton of interaction. When you look at something like hospice, where you're just at someone's home sometimes, interacting with them, just hanging out with them, just being there for them, we consider that clinical experience. Being a home health aide or a caregiver to a family member, we consider that clinical experience, right? It's not a research or an academic center. It's taking care of someone who needs help. And yes, they are a patient, for considering like hospice or a caregiver part of it. They need some help, and you are there taking care of them. So that is clinical experience. Now, the most common one that I get that a lot of students do, and I tell them they probably should either stop doing it or look for something else that would be considered more clinical, is being a pharmacy tech, especially in retail centers like a Walgreens or CVS or Rite Aid or wherever. When you work as a pharmacy tech, you are in retail. You are in a retail center, very similar to working at the Gap, right? It's a customer service-driven, retail-driven environment. And what you are doing is not clinical experience. You are potentially talking to the quote-unquote patient as they are walking up and telling you their name, and you're grabbing their meds, and you're saying, do you have any questions for the pharmacist? And if they say yes, you grab the pharmacist and you take their money and you're done. Right? That's we don't consider that clinical experience. Is it good experience? Sure. If you're thinking about pharmacy and deciding between being a pharmacist and becoming a physician, maybe that's some good experience for you, but you need better and different clinical experience above and beyond that. So ultimately, this specific question, not clinical experience, based on how they kind of framed the position, right? Limited client interaction. Now, if they said, I'm working in the lab section and the patients are coming back and we're discussing the urine sample and what they need to do, and I'm taking the urine sample and I'm taking the blood and drawing the blood and having those interactions, right? That is much more likely going to be considered clinical experience. So again, be the judge for yourself. Don't ask me in the comments, what about this and what about that and what about this, right? Judge for yourself. Do you think you had a lot of patient interaction in more than like a retail way for being a pharmacist, more than an administrative way for being like a front desk person at a clinic, or a check-in person, or being like an emergency room register person when you go to the patient room and register them into the electronic medical record? That, again, isn't clinical experience. Sure, you're quote-unquote interacting with the patient, but again, it's for administration purposes. So that's all I got for you today. I hope that was helpful and gave you some decent advice on how to tackle clinical experience versus not.